In one of my previous videos, I mentioned how patients sometimes go home and Google what you've talked to them about. Here's why that's such a problem. Patients believe the information they see online is accurate. But Google, ChatGPT, and other AI tools are quietly, subtly biasing patients against the truth about hormone optimization. Most patients have sort of a blind spot. They think the internet is giving them objective, balanced information. But the truth is a little bit more nuanced. Google search results aren't exactly neutral. They're based on a business model. What shows up first in a Google search isn't necessarily what's most true. It's what advertisers pay for. It's what bloggers game with search engine optimization tricks, and what content gets clicks and shares. So when your patient searches, let's say, a hormone replacement for menopause, she's not necessarily getting all the facts. She's getting information that's filtered through ads, algorithms, popularity contests. AI tools like ChatGPT sort of work the same way. They don't create truth out of thin air. Well, sometimes they hallucinate and create things that are not true, but that's a different story. ChatGPT learns from the same articles, blogs, websites that your patient's already seeing. If the internet is full of cautious, risk-focused takes on hormone therapy, well, that's what the AI is going to repeat back to your patient. Not because it's the most accurate, but because that's what it's been fed. Both Google and AI are sort of echo chambers. You hear what you want to hear in a way. And the more a patient hears the same message, let's say the lowest dose for the shortest period of time, avoid oral estrogen, that kind of thing, the more patients hear that, the more it feels like the truth, even if the science tells a little bit different story. Hormone replacement for menopause is a keyword that's searched on Google about 9,900 times every month. When I type in that search, I see sponsored ads at the top, plus Google's AI overview. By the way, Google AI is powered by a software called Gemini. It's very similar to ChatGPT. There's a bunch of them. Right here in the AI overview, the same old cautious message. Lowest dose for the shortest period of time, avoid oral estrogen. It's basically the same script that we've heard for quite a long time. Hormones are just about symptoms. Well, there's not even much of a nod given to the idea that optimal hormones can reduce your long-term health risks. Very possibly that's because the FDA doesn't admit that that's true. When it comes to hormone optimization, the deck is sort of stacked to emphasize something that's completely different. Here's a quick note before we go any deeper. If you've ever wished that you had a way to come against those inherent biases and the misinformation that patients get from Dr. Google and even AI tools like ChatGPT, stick with me. I offer some resources that help you do just that in your hormone practice. Now, here's how I know this is a big deal. Patients are searching for these topics a lot. Here's non-hormonal menopause treatment. Search for on Google about 880 times every month. But the results? Mostly sponsored ads, herbal supplement pitches, and vague sort of lifestyle advice, dress in layers, that kind of thing. How about menopause treatment? Over 12,000 searches every month. Same story. Plenty of generic symptom relief suggestions, almost zero mention of hormone optimization, maybe some, but not a lot. Now let's try hot flash treatment. 15,000 monthly searches, more or less. It's all short-term relief strategies and no discussion about the long-term health benefits of optimizing your hormones. HRT breast cancer, more than 4,000 searches every single month. And nearly every result reinforces the narrative that you should be afraid of hormones, that hormones cause breast cancer. And finally, HRT therapy, 90,000 searches a month, dominated by the same cautious, lowest dose, shortest time messaging. Well, it's no wonder patients come into your office confused or hesitant to start hormone therapy. You and I both know that that's not the full story. But to your patient, if she sees it enough times, those answers become the truth. The misinformation can make her hesitate to take hormones. It can make her quit taking hormones or keep her from starting in the first place. And that's where you, as her hormone optimization specialist, can step in. Your role is to guide her through that sometimes confusing maze of information and misinformation. Give her a concise pathway, clarify the claims, and show the evidence. You can also repeat the message consistently across office visits and emails and follow-ups. Repetition can help beat that misinformation that she's getting. When you become the guide, patients feel a little bit safer. They feel seen. They start to trust you a little bit more, and they may follow through, may be more compliant with the hormones that you've prescribed, which means better symptom relief now, as well as better long-term health outcomes later. Well, if you'd like help delivering this kind of consistent guidance without adding hours to your week, I've built a subscription-based patient education system for hormone practices. It gives you a clear, structured way to teach patients the essentials, reinforce the message between visits. This system keeps patients anchored to you instead of the Google or ChatGPT algorithm. In my next video, I'm going to show you how that powerful, systematic patient education system can save you time and reduce pushback from colleagues who just don't get what you're doing. It requires almost zero of your time, yet it gains you about 1 full hour per patient. I've heard that from providers who use it. It emphasizes long-term health benefits of optimal hormones in addition to relieving or eliminating symptoms. Take a look at my next video to see how a structured education pathway can support your practice and your patients. I'll see you there.